All right, so let's talk about detoxification for your cells. If you know me by now, you know that I'm one of the practitioners that truly believe we need to detox on the regular basis because we are faced with allergens, toxicants, mycotoxins, biotoxins, endotoxins, environmental toxins, heavy metal toxicity. We really need to make sure our cells are we're cleaning them. Okay, just like we go to the bathroom, that's how we detox our bodies. We want to make sure that we're moving things that are not supposed to be in our cells. Many of us don't detox, okay? Unfortunately, we all have toxins. So you can do a liver detox, you can do a kidney detox, which we do in our practice. Happens to be one of the steps in any of our programs, whether you're trying to lose weight, or you're trying to balance your hormones, or you're trying to fix your gut. We always detox first, and then we go into the program. But many of us are not thinking about the cellular detoxification, right? How do we get those heavy metals, mercury, cadmium, aluminum? How do we get them out of your, lead? How do we get them out of your cells? How do we get the environmental toxicities, the herbicides, pesticides out of your cells? Because the more we detox the cells, we clean them out, we do a little tune-up, the more they can perform for us. So for me, in our clinic, or for us in our clinic, we promote a lot of chelation therapy, Chelation. And before you go Google chelation therapy and see tons of terrible things about it, I have to tell you, our chelation therapy infusions are very safe. Very, very safe. We make our own formulations. Therefore, we are in control of what we put in the bag. And then we also put things that where patients have no feelings whatsoever, as they are eliminating heavy metal toxicity, environmental toxicity, and mycotoxicity from the chelator. All right. So if you want to see the video portion of this, because I am also screening and sharing my screen here, if you want to see the screen, because I'm going to talk about the key ingredients in the chelation therapy, which looks like this, okay? The key ingredients, you can go on our YouTube channel, Dr. Jennifer Genty. We'll put the link below. You can just click and see the screen, because I want you to be able to see exactly what I'm talking about so that we can eliminate any myth and misconceptions and any bad information when it comes to chelation. I use chelation therapy a lot for my autoimmune patients and my cancer patients. Specifically, if you're receiving chemotherapy agent, you need to chelate. If you have received the right, the vaccines, you need to chelate. Like whatever you injected into your body that is not natural, you have to do because you are mandated, or you are, like you had because you want to keep your job. Whatever the reasons are, there's always a reason why. There's always a solution for you to remove it out of your body. And it is safe in our practice, in our care here. It is safe, it is not toxic, and you feel good. All right. And another reason why we need to chelate, and you'll see on the screen here, if you're looking at the YouTube video, you see that chelation therapy is also good for your heart. All of you guys that have atherosclerosis or plaque in your arteries, and you have heart disease, you need to chelate. If you have high blood pressure, you need to chelate. So according to the American College of Advancement of Medicine, ACAM, suggests that we should use EDTA, calcium or sodium, that's what I use in here, as a chelator for cardiovascular conditions. Because what it does, it goes into the heart and removes the plaque, right? So in this bag, I use two types of chelator, and I use the safest one. I don't do the MSO. I don't do any of the dangerous one. I use the safest one. So I use EDTA calcium, depending on what the blood test is saying, right? Sometimes patients will send over CBC, or we do EDTA sodium, but EDTA calcium is the most popular one because you don't want to remove sodium out of the body. You don't want to put sodium in the cells. So in this bag, we have all the B vitamins. Again, that's why it has this color. You have the B complex, the B6, we have B12. I'm sorry, there's no B12 in here. So the B complex in here, and I put the chelator in here, and that's EDTA calcium. So I can go anywhere from, what is the dosage? We can use anywhere from 5 milligrams to 10 milligrams. So the dosage can be very high depending on your body weight. okay, depending on your body weight, but it is very safe. You can do from 5, 10, depending how much toxicity you have, how you feel. So when you do schedule a vitamin drip with us, we have you complete an intake form. We do look at the intake form. So that's how we determine the dosage of chelator to give you, okay? Because we can do 3 milligrams IV. We also look at any kidney function as well. But yes, it's all about safety for us. You have everything is safe under our care here. I can guarantee you that. So, but besides all the B vitamins, we have EDTA calcium, and I also have another numbing agent because I don't want you to feel anything that's pulling out of your cells. And that's our secret sauce to keeping our patients safe as they are chelated. So, but this powerful bag here is good for all environmental toxins, lead, heavy metals, right? Mercury, if you had dental work done, you have some of those mercuries leaking into your bloodstream, keeping you sick. It's really powerful. It's also good for cancer patients. It's also good for people with cardiovascular conditions. If you want to kill it your cells, you want to free them up so they can repair, rejuvenate, and restore. Remove the trash out of your cells. Give them some love, give them some TLC. If you're watching this in March 2024, we do have a promotion where you can pick any of the IVs. Promotion ends March 2022, March 22nd, 2024. March 22nd, 2024, and then you have until April 2024 to receive the drip. Okay, so it's $250. You can pick from any of the IVs, hydrous vitamin C, immunity IVs, hydrogen peroxide IVs, antiviral IVs, weight loss IVs, chelation IVs, energizer IVs. What else? Hydration IVs. So you can pick from any of the IVs for $250, except for the NADs or the ozone, okay? And you can mix match too, because I believe these little bags can add on to what you're doing, or they can start replenishing your cells so you can get the healing going. Kill it yourselves. COVID vaccine, you don't want that thing out of your body, kill it yourselves. Flu vaccines, whatever vaccines, kill it yourselves. Cardiovascular disease, kill it yourselves. Mercury, toxicity, heavy metal toxicity, lead, kill it yourselves, okay? All right, so I'll see you on the next video. Oh, don't forget to share, subscribe, please. Let everybody know we have, wonderful treatments that can benefit them. We don't want to keep the information to ourselves. All right. So I'll see you in the next video. We're going to talk about hydrogen peroxide next.